It was late evening when my phone rang, and I was surprised to hear my 87-year-old mother say, "Can you come pick me up and take me home?" I asked, "Where are you?" And she said, "I don't know." You need to know that my mother had not been out of the house after dark in at least a decade. She had given up driving years ago. I didn't know anyone who would just leave her somewhere. And most importantly, I was in California and she was 3,000 miles away on the East Coast. I asked, "Do you see a piano?" Hesitantly, she said, "Yes." Whew. I realized she was in her house where she had lived for 60 years. I asked, "Can you see a door beyond the piano?" She said, "Yes." So I said, "Look, I'm going to hold on while you walk to the door, look in there, see if you see a bed and a bathroom, and then come back and tell me. I'll hold on." She came back and she said, "Yes, I see them." I said, "I know where you are. I can't pick you up right now, but you're in a very nice, safe place. The bathroom is clean, the bed is clean, you can lie down, pull up the covers, and go to sleep. Nobody will bother you, and in the morning, the caregiver will be there to help you get up." Mom's Alzheimer's disease was not the usual short-term memory loss. She could remember everything, but she had confusion around time and place. Mom did have caregivers 24 hours a day, but when the bill reached $10,000 a month, it was clear that the more cost-effective way to spend her dwindling savings was to move her to a memory care community. When confronted with the news, Mom dropped to the floor, wrapped her frail little arms around the leg of that piano and wailed, "I will not leave my house." If you ask me for one word to describe old age, I say loss. Not only loss of cognition or home, but loss of work, loss of roles as a provider, parent, spouse, neighbor. Your friends die, your spouse dies. You live in a society that finds little relevance or respect for old age. You lose physical strength and energy. Suddenly, you have gray hair, wrinkles, and sagging skin. Nothing in your body works the way it's supposed to. And one of the biggest losses, your driver's license, independence. For most of our lives, we define ourselves and find meaning and purpose through what we do: work, sports, school. In old age, we lose more and more of the doing, the purpose, our identity, and all that loss leads to suffering. Our society and even health and senior care view old age as a series of losses or deficits of function. As an aging baby boomer who has worked in health and senior care for 20 years, I am terrified of the future that awaits me there. I am more than an aging body. We all, old and young, are so much more. The physical and material are important, but a balance is needed with what I call the spiritual. Today, I invite you to explore the fullness of life that I describe as spiritual, to consider 5 categories of spiritual needs and see how lack of care for them leaves a void in today's patient-centered care. And finally, to discover the greatness of purpose and joy that spiritual care can bring to your life. Let's get started with the word spiritual. In old age, there's a lifetime of spiritual development. Qualities and accomplishments like creativity, insight, wisdom, developing skills and honing talents in excellence. Virtues like love, patience, kindness, honesty, empathy. We recognize and value this spiritual development when we see it in other people because it produces beauty, order, tranquility, purpose, and happiness, not only to an individual life, but to society in general. I became aware that if we can value each other for how we can spiritually be, in addition to what we can physically do, then we can ease the loss and suffering of old age and redeem our own futures. So excited, I wrote a book about it. But meanwhile, I was working in health and senior care, not only with seniors and their families, but also on the business side. I met amazing doctors, nurses, and senior care professionals who truly cared about patients and residents. But I saw limitations, and I saw problems that affected patient care. One CEO of an agency that received referrals from medical doctors told me 80% satisfaction rate was good enough. Really? I think medicine should always aim for 100%. I saw differences among senior care communities. Some were full of purpose and joy. Residents loved living there. Employees loved working there. Others had bored, lonely residents and staff just going through the motions. The difference was spiritual care. It's needed in the workplace for owners, managers, and employees. The United States spends far more money on health care than any other country in the world, $3.6 trillion. So, don't you think we should have the best health care in the world? We don't. Year after year, compared to other wealthy, industrialized nations, Americans are more likely to be sick, disabled, and die. Actually, our lives are 3 years shorter. According to the World Health Organization, the United States is ranked 37th in the world on patient outcomes. Outcomes are measurements of quality, of excellence. When the United States spends more money on health care than any other country in the world, it's not a material problem. Lack of quality, lack of excellence is a spiritual problem. When you do anything, write a report, swing a golf club, remove a gallbladder to the best of your ability with focus, intent, and care, that's the pursuit of excellence. That's spiritual. When the spiritual needs of people are ignored, their humanity is ignored. It becomes easier to justify every decision on the basis of material gain. Excellence, quality, is replaced with financially acceptable levels of liability, or how many lawsuits can we afford? As a for-profit business, American healthcare values production and consumption. Individuals become patients on an assembly line designed to maximize patient throughput. There's not a lot of humanity in that process, but growing old seems to be a billable condition, and there is a lot of revenue in that. Another example of ignoring humanity for material gain is the practice of denying millions of health insurance claims, totaling billions of dollars every year. A friend on dialysis needed replacement for a stent in his arm. The physician's order was rejected 3 times. Finally, the insurance company sent approval on the day of his funeral. He had bled to death at home the week before. Meanwhile, the average pay to a health insurance company CEO is $20 million a year. There's more than enough money. It's just not spent on patient-centered care. A spiritual problem cannot be solved with money. A spiritual problem requires a spiritual solution. In her early 80s, My Aunt Ethel lived alone on a farm in a southern state, gardening, running a successful catering business, and enjoying an active social life. She announced to the family that she wanted to move into the local skilled nursing facility where she had been visiting so many friends because there were so many interesting things to do and lots of visitors. Well, Aunt Ethel did eventually move in, and she loved it. Many of the residents had known each other for decades. Their families knew the families of staff members, and the same family had owned the skilled nursing facility and hospital for 3 generations. All the churches for miles around sent volunteers. Sunday school teachers, pastors, choir groups, even flowers. Locally grown fresh vegetables were enjoyed at mealtime. The activity director baked from scratch cakes, pies, and cookies, and between bites, residents evaluated recipes. She churned butter, and residents reminisced about milking cows and caring for livestock. Everyone went outside to watch a hog barbecued on an open-air spit. Banter over the best sauce for ribs filled the air, along with that delicious, distinctive aroma. I was there. The skilled nursing facility wasn't perfect, and the care wasn't perfect, but the residents and the staff and the owners were thriving in a community where mutual respect and mutual dependence pervaded their daily lives. They truly cared about each other. There was a waiting list of older adults who wanted to move in. Employees were fairly paid, received generous benefits, and staff vacancies were immediately filled with the most qualified nurses. The facility was clean, bright, cheerful, and well-maintained, even though 90% of the residents were on Medicaid. Nothing was worn or needed paint or repair. This was a low-income Medicaid long-term care facility in the middle of nowhere that was wonderful. If Medicaid can do this, any place can do this. Spiritual care is cost effective. Here are my 5 categories of universal spiritual needs and care. 1, purpose. How powerful is the search for purpose? What contribution do you want to make to the world? What gets you out of bed in the morning when your joints hurt, you think no one really needs you, you need glasses to see, hearing aids to hear, and your energy's gone after getting dressed? In a senior care community, a frail little lady sat in a wheelchair by the front door every morning and afternoon, beaming and calling out a friendly hello to all who entered. Occasionally, a visitor would take time to sit and talk for a few minutes to make a heart-to-heart connection. And upon leaving, the little lady would take their hands in hers and say, "I'm old, blind, sitting in this wheelchair. I can't do much, but I can pray for you." Purpose. Category 2, social cohesion, unity. The secret of success of Aunt Ethel's senior care community was the love, care, and concern that each person had for the other. Those virtues created unity, trust, a sense of wholeness for every member of the group. Science has proven that everything on the planet is interconnected. We accept this physical oneness, but spiritually, we don't always see ourselves in others or them in us. This lack of connection is negatively affecting our health. For example, the respected Rosetto study in Northern California showed people living in a close-knit community with social support and cohesion have half the heart attacks of people in the region and half the heart attacks of all Americans. A successful community is one where every individual acts with concern for the well-being of all members. That equity evolves to justice and then to unity. Category 3, spiritual safety. Think of a time when you felt emotionally vulnerable. How did you feel? Vulnerability, dependence, isolation are real for older adults with physical and mental decline. Like my lost mother phoning for the ride home, or clinging to the piano leg, terrified of losing her home. Questions like, who will take care of my wife when I die? I've left my home and live with strangers. Will I like them? Will they like me? Will they take care of me? I was inspired by a nun who got into bed with a hospice patient, cradling her in her arms and promising her she would not die alone. When expectations for quality care are met, trust emerges. Faith in the community emerges. Optimism and loyalty of both residents and staff appear. Category 4, connection to the divine. Have you wrestled with a difficult problem and suddenly, when you weren't even thinking about it, the solution pops into your mind or comes to you in a dream? Have you lost track of time and place in a bliss of creativity? Has a chance meeting or perfect timing changed your life? These examples of inspiration, creativity, and synchronicity are spiritual powers. It's where we reconcile the tension between ourself and a greater good, where we find meaning for the losses in our lives, and in understanding and acceptance, the end of suffering. Spiritual power can be stronger than physical power. Just ask any hospice nurse who's watched a dying parent linger, waiting for a favorite child. Category 5, spiritual air, food, and water. Well, just as our physical body needs air, food, and water to live and grow, so does our spirit. For example, prayer and meditation are spiritual air that can relieve despair, anxiety, and stress. Scripture, poetry, inspiring stories are spiritual food that provide hope, comfort, and courage. Nature is spiritual water with power to immerse and refresh us. We need to hear our favorite music. It lifts our spirits. We need virtues. We need to see beauty and delicacy, to feel love and kindness, to receive fairness and justice, to hear truth. Everyone, young and older adults with dementia, needs this basic care. In closing, some of these spiritual needs are already part of senior care, but they're not considered vital. They're not written down and measured in a spiritual care plan, not reimbursed by insurance or Medicare. And what doesn't get measured or reimbursed doesn't get done. Health and senior care are based on a biological model of care with some psychological and sociological needs addressed. These three are important, but we also need recognition of spiritual needs. We need to name them, measure them, talk about them, and learn how to fulfill them, because caring for the spiritual heals the physical, lessens pain, relieves boredom and depression, gives purpose, a reason to get out of bed, and leads to better quality of life. Old age is inevitably a time of physical loss, but it can be a time of spiritual greatness. How do you want to live?